My name is Susan LaLiberty, and I'm here to introduce our group project. Our group focused on advancing nursing through accredited nurse residency programs. As you know, nurse residency programs have existed in the hospital setting for a number of years. They were created in order to help new graduate nurses transition from the academic environment to the clinical environment. However, research has shown that these programs, they vary quite a bit in the content they deliver and the duration of their programs. So the IOM and Joint Commission have both, for a number of years, called for organizations to adopt standards for their nurse residency programs to ensure that all nurses are receiving, consistent training when they come out of school, so that they can be successful in the clinical environment. Because some studies have shown that up like 18% of new graduate nurses will leave their profession in the first year of practice without proper support through these nurse residency programs. So we're going to talk about what accreditation is, why it's important in advancing nursing, and just all of the different benefits that exist from achieving accreditation for your nurse residency program. So now I'm going to turn it over to Sarah, and she is going to give you some background on this.
Hey guys, my name is Sarah. Today we're going to be discussing the background for the topic that we chose. Our group chose to talk about advancing nursing through accredited nurse residency program. Today we will be answering these three questions. Why is the situation like this? What is the current practice? And what is the background of the current situation? So as new graduate nurses, our competency, confidence, living experience are quite limited, and so nurse residency programs can help to combat these issues. So in the past 10 years, there has been a great increase in nurse residency programs for new graduate nurses. The American Academy of Nurses believe that there's critical need for nurse residency programs and that it should be required for all new graduate nurses. And something to think about with this is that funding is required for these programs. So in order for these programs to happen, there must be proper funding for this to occur. So the need for nurse residency programs includes that patients are living longer, technology is growing, people are now having multiple chronic conditions, and the body system just is becoming more complex. And as new graduate nurses, our experiences and skills concerning these issues are quite limited, and nurse residency programs can help combat these limitations that new graduate nurses often have, once they begin practicing and once they start working as a new graduate nurse. So the goal for nurse residency programs is to improve nurse retention, expand competencies, and improve patient outcomes. And the focal point of healthcare or nursing is providing safe, quality care. And with nurse residency programs that can help nurses to feel competent and confident in performing nursing skills. And like I kind of mentioned earlier, the main focus of nurse residency programs is to improve patient safety, provide quality improvement, and using evidence-based practice. And along with these three things, it requires a higher level of thinking. And so nurse residency programs can help new graduate nurses to feel equipped to have a higher level of thinking. And it was reported that employers feel like new graduate nurses are not ready to practice. And so with nurse residency programs that can help employers to not feel like they cannot trust or that they do not feel confident with new graduate nurses practicing in real life. So nurse residency programs, they're important. It can help decrease errors, like I said, increase nurse retention rates, improve well-being and job satisfaction, and improve critical thinking skills, and overall providing safe, quality patient care.
Hi, my name is Leah, and I will go ahead and be talking about the assessment portion of our project. So, as Susan and Sarah already talked about, these nurse residency programs are growing in popularity, and that's great. However, most of them are lacking the standardization and accreditation that they really need to be effective towards these new grad nurses that are coming into the field. So there are a couple of reasons as to why hospitals are choosing not to be accredited. It really boils down to a money issue. Most of these hospitals don't have enough money to allocate resources to these nurse residency programs. That could be instructors, that could be, resources such as like activities they might need to really prove a point in whatever skill they're talking about for that day. So it really boils down to what is available. Do they know the criteria that they need to be accredited? Do they need to get the education from somewhere? That is something that we will talk about later in our presentation. So let's go ahead and dive deeper. What are the stakeholders that are a part of this? We got 3 main ones. We have our new graduate nurses, we have our employers, and of course we have our patients. So more importantly, our new grad nurses are very important when it comes to obviously being a part of the accredited nurse residency programs. Without the support that these programs give the new grads, they're not becoming competent or confident in their skills. Without any of those feelings that they might have, they're leaving the hospitals. They feel like they're not being supported. They feel like they don't know what they're doing. So if they're unhappy, they're going to leave. So that brings in our next stakeholder, which is our employer. This is very important for our employers to recognize, because if you are not holding on to these new graduate nurses, it ends up being a financial issue. It is more expensive to bring on a new person than it is to keep and retain staff. So it's very important to have these accredited nurse programs, because they are starting to become more confident in their skills. They're going to stay longer, and so you'll have that retention. That brings us to our last stakeholder, which is our patients. So with these accredited nurse residency programs, they're really able to practice skills they didn't practice in nursing school. Nursing school really prepares you for NCLEX and perfect answers on the NCLEX. What nursing residency programs really focus on are more communication skills, ethics, things of that sort. With these, constant communication of skills, they're becoming more confident in their skills and competent, which is very important, because while we're being competent in our skills, that also means that we're making less patient errors, which obviously increases patient outcomes. So these are all very important stakeholders to keep in mind when deciding if a program should be accredited or not. Moving on, we're going to go ahead and talk about our nurse-sensitive indicators. These nurse-sensitive indicators include structure, process, and outcomes, and we're going to talk about all 3. With our structure, we're improving the education that these new grads are receiving. Like I had said earlier, they're getting communication skills and ethics skills, along with so many other things they learn in these programs. But with that elevated education, you're also seeing an elevated amount of retention, because they are becoming confident and competent in those skills. That also means more available staff, because the higher retention you have, the more available staff you have to work around the hospital, which is fantastic. With our process, we're seeing a higher level of proficiency in skills and happiness. So it also means with that early support, with our outcomes, which is our next nurse-sensitive indicator, our outcomes are improved, especially with patient errors, because with the nurse residency programs, they are getting constant supervision early on in their career. The most scariest part in their career, handling patients on their own, not really knowing what to do. They always have somebody in their corner from the nurse residency program that can kind of guide them and supervise them along the way in their journey. So that's a very important aspect of an accredited nurse residency program. Even though there's so many benefits to becoming accredited, hospitals are still choosing not to be accredited. And like I said earlier in the beginning of my presentation, that could be due to many different things, which could be education. What do they need to become accredited? What criteria do they need to meet? Funding, hospitals can be very tight on money. They might not have the resources that a bigger hospital might have to become accredited. But it should be something that should be looked at within a hospital, because without these accreditation, you're starting to lose nurses. You're losing that retention. You're having an increase in medical errors because your nurses aren't that competent as they could be with an accredited nurse program that's getting, constant supervision within that first year of nursing, which is so important because that's when you start to mold your nurses into becoming the best nurse that they can be. So these are things that people should be thinking about, especially if they're working in a hospital setting. But we're going to go ahead and talk about more of that later in the PowerPoint. So I'm going to go ahead and hand it off to Paige. Thank you guys so much.
So in order for nurse residency programs to be standardized, they would need to do something like the PTAP program is. The PTAP program is a practice transition accreditation program, and it's a successful ANCC program that hospitals apply to for an accredited nursing residency program. In order to get approved for a PTAP program in your hospital, you must do approved research projects, pay the fee, create a SMART goal, and leadership must be committed to ensure that they can keep up with accreditation requirements. Doing something like this means that everybody's doing the same kind of projects, everybody's practicing the same kind of skills, and everybody's getting the same amount of help to transition from new grad nurses into the actual nursing field. So whether it's the PTAP or any other program there is, just having a specific list of things that have to be included in your program can ensure that we're all getting the same fair help. It would be the same time, it would be the same skills, and it would just be more standardized. So in order for that to go through, every hospital would have to agree, or at least every hospital in the state would have to agree on one nurse residency program that they wanted to use, and then they would all have to apply with that and keep up with it. So this would be a really big deal for the management side because they would have to make sure that their staff is committed to ensuring that they're following all the requirements of this program. But I think long term that it would really help new grad nurses to be able to be on the same page and really be prepared for what is going on next.
Okay, I'm Sam Carvajal, and I had the recommend portion of our group leadership project. And we think that the recommendation should be that nurse residency programs are standardized, at least amongst hospital organizations within the same state. So that would mean, just for example, like HCAs in Kansas should probably all have a very similar framework to their nurse residency programs. The reason we think this is because when you look at it objectively, specifically when we looked at researched, peer-reviewed, long-term research of nurse residency programs, we found that the benefits objectively outweigh any risks or issues. First and foremost, what we saw a lot of was that it supports Roche's 5 C's of caring, which directly equates to higher levels of patient care. Now, when I say the 5 C's of caring, what we saw a lot of in the research was that nurses, specifically new grad nurses entering the floor for the first time, felt much more competent and much more confident in their abilities entering the floor as a new grad nurse. We also saw higher retention rates of new grad nurses, specifically past that 1 year mark, where we're seeing high levels of transition, which means that hospitals and organizations have to take on new staff, which need to be trained again. And it's just kind of this bottleneck of waiting for somebody who can go on the floor and finally start doing that nursing task. So we saw lower levels of retention, which means we have higher levels of continued care and people who know what they're doing on these floors. Additionally, there's competitive advantages, which is great for organizations and individuals within those organizations. We see that organizations get reimbursed in the long term when they do go through some kind of standardization or accreditation. And what surprised me, and I think surprised the whole group, is that we found that there's lower rates of workplace violence and bullying when there is some kind of standardization or accreditation attached to nurse residency programs. And specifically, what that means is that these new grad nurses, they were acutely aware of who their chain of command was. They knew who to go to with issues, specifically relating to violence and bullying. They also were given assertion training and were empowered through that assertion training, so they were able to stand up for themselves more. And they also were given resources such as self-care and mental health resources within the organization. And so what we saw was that when there was workplace violence and bullying, it wasn't a prolonged thing. It was stopped immediately, either through assertion on the individual level or immediately brought to the chain of command so that leadership can get involved and ensure it didn't continue. So one of the questions that we were tasked with was how can we make this change within our organizations? And I think that's kind of difficult when we're talking about nursing students and new grad nurses. But just because it's difficult doesn't mean it's impossible. So what we can do, at least as nursing students and new grads getting ready to join the field, is when we're going through these interviews and we're looking to join organizations, right now what we can do is just simply ask, what does your nurse residency program look like? What does it entail? What have you heard that are the benefits and possibly some of the issues involved with it? But asking that, I think, is that first major step we can take. Next, what we can do is that we're going to have face-to-face time on an individual level with key stakeholders within our organization. Now, there should be an initial sit down that tells us as new grad nurses what our expectations are. What should we be expected to do as that new grad nurse on the floor. But following that, at least on an annual basis, and probably more often, we're going to be sitting down with these key stakeholders, key leaders, and they're going to be evaluating our performance. But that's a time that we can use to engage them. We can reach out to our friends and colleagues across other organizations and ask them about their nurse residency programs. What do they feel more prepared for through their programs? What do they think some of the issues were? And how would they make their own programs better? We can do our own individual research because, as you can see here through our presentation, there's plenty of peer-reviewed long-term research on the benefits of residency programs being standardized and accredited. And then we can bring all that information to these key leaders that we're going to be talking to. And most importantly, what we can do is provide our own personal experience. Now, a key leader is going to love that because they're talking to somebody who's on their floor, doing specific tasks. So maybe cardio, pulmonary, wherever you are. And you're going to be able to tell them how the residency program specifically helped you as that nurse in that institution. How did it benefit you? And then you can bring them the issues, the risks. I didn't feel as prepared for X, Y, and Z. And they can go on and they can bring that to their leaders and can go up the chain of command. And hopefully we can see those changes. Now, I hope that kind of convinced you as why we recommend it and what we can do to change it. And all that being said, I'm going to hand it off.
We're going to wrap this up talking about the outcomes of nurse residency program accreditation. So accreditation would finally meet that expectation or that request by the Institute of Medicine and the Joint Commission for nurse residency programs to achieve standardization. So that's a great thing. And I think out of that comes like a trifecta of goodness. That's what I think of it as. First off, it advances nursing by really supporting new nurse graduates in giving them what they need to be successful in the clinical environment. That really includes building their confidence, improving their hands-on skills in the clinical setting, giving them enhanced or helping them build enhanced communication skills, problem-solving skills, critical thinking skills. All of those things come together for new nurses and improve their level of job satisfaction. And what we've seen in research is that nurses that have a high degree of job satisfaction tend to stay in their jobs longer. And it also produces better outcomes for patients. So patients who have happy nurses, they feel better about the care they're receiving, and they tend to have better outcomes. So for patients, it's a win. And for employers, it's also a win because employers have nurses that are happy and satisfied, they're staying in their jobs, and that reduces the amount of that reduces expense for employers. So it's really a win for everyone on every level. So like I said, trifecta of goodness. So hopefully in the future, we'll see more employers who are working towards achieving accreditation for their nurse residency programs. this will definitely produce good results for that organization, and it will advance nursing as a profession. So thanks for listening to our presentation. We hope you enjoyed it.